as I said earlier on, for safe disposal, as well as having the ability to maintain hygienic conditions through services such as garbage collection, industrial or hazardous waste management, and wastewater treatment, as well as disposal. In the absence of all that, then sanitation is in bad shape, and the consequences of such a situation are quite profound, and at times they even claim lives which could have been saved otherwise. Next, please. Sustainable sanitation emphasizes on the containment of substances that are harmful to the environment and reuse of nutrients. Because we all know whatever we use that is in form of liquid or fluid finally finds their way into the aquifer or water bodies. So we have to ensure that we safeguard our environment by containing the substances that are harmful to the environment and the reuse of nutrients. When we talk of sanitation governance, this refers to the rules, roles, and relations that make sanitation system work, or at times not work, and at what cost and for whom. And this is particularly important, especially in developing countries and Africa notably. There are rural-urban differentials with regards to sanitation systems. So the rural-urban differentials exist, but also the income status differentials exist. You find in most cases in rural areas, sanitation systems are inadequate as compared to urban areas. But also those who are in the categories of high income and live in high income areas, their sanitation systems are also different to that of low income areas. And that's why you find most of the time a breakout of infectious diseases only happen in low income areas, people in upmarket areas, where they have good sanitation systems and also water system in place, can hardly, encounter preventable infectious diseases. And I have it in blue over there on your screen. If you want to have a detailed understanding of the rural-urban differentials with regards to sanitation systems, but also water systems, as well as income status differentials, you can refer to the demographic and health surveys in your respective countries. They normally display these issues, health issues, water issues, sanitation issues, by areas of residence, that is rural and urban, but also by, economic status. So you can refer to that for just to broaden your knowledge as a specialist in the area of water. Probably it might be good to be very much aware of what we are talking about. Next, please. So the dimension of water, it went faster than I could read. IWRM, no, it's okay. It's just the dimension of water and sanitation governance. Sorry, next, please, Ronel. So IWRM is one of the key approaches for enhancing good water and sanitation governance, rather than a goal on its own. This approach, as it reads, it's integrated water resources management, but it is an approach that is also important with regards to water and sanitation governance because of the nature of the approach itself. And as I'm going to present a little later, it's actually looked at as a paradigm shift from the traditional approaches to managing water resources, but also water and sanitation. It is imperative, therefore, to first define water and sanitation governance in order to be on the same page with regards to what water and sanitation governance means and its application to water resources management. And next, please. So what is water governance? There are numerous definitions of water governance, as you can see on the slides. And so far, there is no really consensus with regards to the term water governance. Because the means of characteristic that should include a good water governance system is still contextual. People define it differently, but there are still certain common aspects to the definition. But so far, literature informs us that there is no consensus like an agreed, universally agreed definition of water governance. Next, please. The GWP, which I'm sure all participants are aware of, they know about it, and R and Wang define water governance as a range of political, social, economic, and administrative systems or rules that are in place to develop and manage water resources and the delivery of water services at different levels of society. So here in the GWP definition, the key words are political, social, economic, and administrative system that are in place to develop and manage water resources and delivery of water services at different levels of society. But then the OECD defines water governance as a process that involves different actors and perspectives in decision making, and it is focused on administrative and institutional dynamics and includes both formal and informal organizational aspects. So far in these two definitions, you can see similarities or some words which appear in the two. The OECD, which defines water governance as a process that involves different actors. And when you look at the GWP definition, which talks of a range of political, social, as well as economic and administrative systems, you can see where there is political, there are stakeholders or actors which are in that particular avenue. And then you have the social aspect to that definition of governance, which also brings in actors, different actors, and the economic as well as administrative system also bring different actors. And of course, even the OECD definition focused on administrative issues. So you can see, as I said earlier on, much as there is no consensus on the definition, like when you say water governance, this is what it should be known. But as I said earlier on, there are some aspects, these definitions, they don't diverge much from each other. Mostly it might be the choice of words, but rather they point along the same direction. Next, please. And the UNDP defines water governance as encompassing the political, we're going back to political issues, economic and social processes and institutions by which governments, civil society, and the private sector make decisions about how best to use, develop, and manage water resources. Again, the variables that had been mentioned by the GWP and OECD appear in the UNDP definition. And then for UNESCO, it talks about essentially who gets what water, when and how, and decides who has the right to water and related services. Now, when you look at the UNESCO one, you can definitely agree with me that there are actors involved, and the actors will be in different categories like the political, socio-economic, because who gets water, we're talking of the social issues here. When and how, probably the politics come in and decides who has the right to water. Again, it's the issue of economic, social, and political come in, although they have not been explicitly mentioned. So as I said earlier on, we don't have a definition that is universally used, but different definitions are not departing from one another. Next, please. Again, the OECD defined it as water governance encompasses political, institutional, and administrative rules, practices, and processes, both formal and informal, through which decisions are taken and implemented. Stakeholders articulate their interests and have their concerns considered, and decision makers are held accountable in the management of water resources and delivery of the service. Now, here comes maybe a new variable to the definition, and that is the accountability. Accountability of the decision makers. But stakeholders, it's not necessarily a new variable in the second OECD definition, because when you talk of matters of political, social, and economic and administrative, you're talking of different actors or stakeholders thereof. But the only sort of new variable that comes in here is the accountability part. And honestly speaking, good governance, be it in water, sanitation, or anything, accountability should be part of it. People have to be accountable. But also, the interests of stakeholders have to be considered. And these stakeholders must be able to articulate their interests, for their interests to be taken into account, for those who are in position to do that. And those who are in position to do that must also be held accountable. And on the other hand, the Water Governance Facility defines water and sanitation governance as the rules, roles, and relations that make water and sanitation systems work. Of course, at the end of the day, what we want to see is effective water and sanitation systems in place. And that involves more than one stakeholder or more than one actor. So this water governance facility definition, again, doesn't markedly depart from the other definitions that have been put forward by other authorities. Next, please. Water governance has also been described as a range of political, socio-economic, and admin systems that are in place to develop, manage water resources and delivery of water services. This is a difference. This is just like the one that had been put forward by the I think it was OECD or Global Water Partnership. So as I said earlier on, the point of sharing, as I said earlier on, these definitions are not different from one another. They all point to stakeholders or different actors, they all point to political issues, they all point to social issues, economic and administrative issues. Maybe the GWP is the one which introduced of the formal and informal actors, and the other definition that we had introduced the accountability part to the definition. But more or less, they all point to a range of stakeholders. They all point to the fact that water and sanitation governance is a system and not a goal in itself that should be in place to ensure that the water and sanitation systems work and services are delivered and to different levels of society. Next, please. And this had also been mentioned, I think, by OECD on a water governance system says, determine who gets what, when and how, and who has the right to water and related services. Is this not a repetition of my slide? Sorry, let's go to next. Next, please. Ronel. Okay, yeah. So sorry. Go back, please. Sorry. So you can see from the different definitions of different institutions, different practitioners, different authority, different scholars, that water and sanitation governance are issues that have received adequate attention. Especially water and water resources and water governance receive more adequate attention as opposed to sanitation. Even when you scan through literature, if you go through various outlets for publications and you try and look for published papers, research that had been presented, have been conducted, and results published in water, you will find a whole list. You will find a whole list as opposed to when you try to find out a number of published work on sanitation. So sanitation seems to be often getting inadequate weight. And you as practitioners, in your pursuit of PhD in your different areas and countries, probably are aware of the fact that sanitation receives, inadequate weight as opposed to water. So maybe you can try here and there to ensure that these two go at par, because much as you can have enough water, adequate water that we need, but if we are not having good sanitation systems and governance in place, we will defeat the purpose of having, adequate availability of water. So these two must receive adequate attention. Sanitation governance is defined as rules, roles, relation that makes sanitation systems work or don't work. And the governance system thus comprises of governments, local authorities, private sector, civil society, and other stakeholders in the project areas. This again goes back to the water governance or governance itself. As I said earlier on, the definitions actually basically point to different stakeholders or actors at different levels. Next, please. So the dimensions of water and sanitation governance. The social dimension refers to or focuses on the equity of access to and use of water resources. This is where you find, as I said earlier on, the rural-urban differentials of access to water and also access to sanitation. And again, even the rural-urban, even within urban itself, there are differentials depending on the location. In different countries, I believe, there are areas where, people, when you talk of inadequate water and poor sanitation, it's like something they see in movies or they see on TV, but they've never and will probably never experience. So the social dimension means access and use to water. It focuses on equity. Now, for us as water practitioners in our different areas of expertise, we are expected to take into account equity. I mean, we are all human beings, whether I live in upmarket area or I live in whatever low status area, but we all need water, we all need adequate sanitation. So the social equity aspect is very important. And in some places, there is some sort of subsidy to availability of water to the sort of disadvantaged population. So if you are advantaged, you are expected to pay a little more that goes into supporting or making available making water available to those who are a little bit disadvantaged as compared to yourself. And this ensures equity across. Because you see, some of the things that people might take for granted, if there's an outbreak of some infectious diseases, at times it knows no limit. You might find yourself getting infected regardless of your status and where you live and whether you have these things or not, the services or not. So that's one. But again, on the second issue of human rights, I mean, we are all equal, so we should try to share, especially this God-given resource, which is vital to our lives, and that is the water resource. So that is the social dimension. And then there is the economic dimension. This refers to efficient water use and water's role in the economic growth. Much as water is regarded as a free good, but maybe its occurrence is free, rainwater, river, lake, ocean. But there's a cost, we all know, to getting the water from the source to the point of utilization. And costs involved have to be paid for. And that is the economic dimension of it. In some countries, like where I did my PhD in Japan, they used to have flat rate. For instance, if you use, I don't know, an example, maybe 200 cubic meters of water, there is a flat rate to that. Maybe you pay maybe 4,000 Japanese yen. That's just an example. And then thereafter, from the flat rate cubic meters, any additional amount is paid very highly. I found it a very good way of ensuring that water is used efficiently. Unless you don't care, unless you just don't mind how much money you spend on water use that you could have otherwise saved, you would go beyond the flat rate for no reason. But you find majority of the people where I did my studies, and I also did some research there, you find the majority actually try to limit themselves to ensure that they use the prescribed amount that you pay a flat rate for. Because the more the water you use beyond the prescribed amount, you pay dearly. So I found it one of the initiatives that helps people to use water efficiently, but also it is an incentive to ensure that water is conserved, other than leaving it the way it is. So the economic dimension is another part of water and sanitation governance, as I explained earlier. There is also political dimension. Here, the focus is on providing water stakeholders and citizens with equal rights and opportunities to take part in various decision-making processes. You see, the political aspect to water and sanitation governance doesn't just involve politicians to sit in their offices and decide where, when, and to whom they should provide water. But it goes beyond that. Of course, they're involved because finally they go and make a case, maybe to the Minister of Finance or the Minister of Water. So finally they are supposed to be involved. But in terms of water and sanitation governance, the political dimension goes beyond the politicians. It includes providing water stakeholders and citizens with equal rights and opportunities to take part in various decision-making processes. People are not happy when we sit as practitioners or as politicians and make decisions for them. It's not acceptable, and more often than not, it brings problems and challenges that could have not have been experienced. And the political dimension to water and sanitation governance actually, in other way, you would say, ensures or strives to ensure a meaningful stakeholder participation, where stakeholders are involved and they are given rights, and not just rights, because if you give one right without availing them an opportunity, then you have not meaningfully involved the stakeholders. So you involve them, you give them equal rights and opportunities. And when we say equal rights, we mean equal rights. And here I would like to bring the dimension of gender. When it comes to equal rights and opportunities, more often than not, literature informs that, these power relations between men and women, at times, there's no balance. But in any case, that's a topic for maybe another time or another module. But with regards to water and sanitation governance, what we want to see is that stakeholders and citizens are given equal rights as well as opportunities to take part in various decision-making processes. And you as practitioners within our region, I must mention I must mention and probably urge you to consider the gender aspect, because how we all know how a woman suffers from challenges of inadequate water and poor sanitation is different from that of man. So involving both groups will assist us to achieve or to realize good water governance in place. But again, the differences in the stakeholders and citizens doesn't simply end at the gender differences. You know, there's also power relation with regards to who has what in terms of wealth, and more often than not, you find those who are on the lower level of wealth quantile at times are denied equal rights and even opportunities to air their views and take part in decision-making processes. So again, I repeat, as water practitioners, when it comes to water and sanitation governance, and when it comes to bringing in the variable political dimension, I would kindly urge you to look at the dynamics within stakeholders, dynamics within citizens, because we are not a homogeneous group. There are differences amongst ourselves, which at times make others enjoy more rights than others, and also make others, get more opportunities than others, especially in terms of decision-making processes. And then there is the environmental dimension in water and sanitation governance. And in this, the emphasis is on sustainable use of water and ecosystem services to enable lasting access to water and sanitation for all. When we are not careful enough to protect our environment, we finally are all going to suffer. The ecosystem services will not be in good order, and we all know without a proper and healthy ecosystem services, we are in trouble with regards to water resources. And we are also in trouble with regards to having lasting access to water. And then sanitation will also be jeopardized, because it's very difficult to have proper sanitation in place in the absence of water. It's difficult. It might happen, I don't know how, but it's difficult and it might be very costly. So those four are the dimensions of water sanitation governance: the social aspect, the economic aspect, the political aspect, and the environmental aspect. Now, within the various aspects, especially social and political, you find other dynamics like the power relations issue, the residential differential issue, the wealth differential issues, and also the gender differential issues. So these have encompassed some of the dynamics, some of the variables that we see and we live up to in our settings. Next, please. That's just a diagram of the dimensions of water governance and sanitation, of course, that I have just explained. On top, you have social dimension, and I explained you have the equitable use. Then you ensure, if you have that, then you are attributing to water governance, and then you have the political dimension, economic and environmental. I wouldn't repeat myself. We can move to next, please. Next, please. Yeah. So, please go back. I want that question. So I had this question. on how does each of the variables contribute to good water and sanitation governance. But I guess I had the answer ahead of the question. Next, please. There are 4 dimensions of water governance, as I said earlier on. The economic, but also administrative, and they influence water use and management. And the water governance is one of the most critical areas through which to improve sustainable development of water resources and services. Based on the variables that I presented to you earlier on, I'm sure you can easily link good water governance and sanitation with sustainable development of water resources as well as services. And we can only realize sustainable development of water and water resources and services, and also sanitation services, when we have good governance in place. And good governance in place means, different actors come into the equation, different stakeholders are meaningfully involved for the common goal. Next, please. Literature informs us that good governance basically depends on the quality of leadership, the strength of the institutions, and how efficiently, effectively, sustainably, transparently the resources are managed by sector institutions and main stakeholders. You see, governance, as I said earlier on, according to literature, governance is actually a process. And if it is a process, it means it's something that is happening on a daily basis. And for a process, we need somebody to be like on the steering wheel. It's like a journey where you have somebody who is either a pilot or a driver. So good governance depends on the quality of the person or a group or institution which actually takes the lead, and this is leadership. The leadership that we want for us to realize good governance should be a quality leadership. But then you can't have quality leadership and then you don't have strong institutions. Strong institutions are important in the water and sanitation governance, or strong institutions are important for us to realize good governance in place. And these institutions, apart from being strong, they also have to be efficient. They also have to be effective and also sustainable. Because it makes no sense when you have a strong institution, but then it's not sustainable. Everything is not sustainable. You realize the goal for just some time, and then it becomes a history. And that's not good governance. Good governance means everything that is in good order has to be sustainable. Transparency is something that also goes into the equation of good governance. We all want to know how resources are managed. We all want to know who gets what and why, who pays for this and that. Doing things behind the curtains, actually, even if you're doing the right thing, but honestly speaking, you have a recipe for problems and challenges. But when you are transparent, firstly, apart from just making sure people understand what is going on, because we all own these resources. No one can claim to own water resources anywhere, but we all own because we are part of the globe. But when you are transparent, you also stand the chance of learning from others. When you are transparent, people will be able to assist you, give you ideas, give you recommendation, give you, different perspective of doing things for a common goal, other than not being transparent. And for me, if somebody is transparent, that somebody in principle accepts that they don't know it all. That institution or leadership or authority acknowledges that stakeholders out there have valuable information and valuable contribution towards a common goal, and that is good water governance and good sanitation governance. But when you are not transparent, it means you're doing things on your own, you know it all, and you do things without involving people. But when you are transparent, so transparency is the one important variable for good governance, especially with regards to resources, and not only resources, but vital resources such as water. We are all stakeholders when it comes to water. And honestly speaking, it is in our own interest, everybody is interested to get to understand what is going on and why. And then literature also informs that sound governance therefore relies on the constructive cooperation. This is what I said about being transparent. When you are transparent, it means you are encouraging cooperation between various actors and sectors. And sound governance aims at securing services that are both efficient, sustainable, with resources used efficiently, and power exercised reasonably. This is exactly what I said earlier. When you are not transparent, it means you are exercising power on your own, and then you are showing people that you know it all and you can do it on your own. As water practitioners in the region, this is not expected, and it should not happen actually for our common good. We should be transparent. We should ensure we realize good governance in place. Next, please. Now, access to water and sanitation, challenges of poor water, sanitation, and inadequate water. Next, please. I thought of bringing to your attention things that I said earlier on. You might know all of these things, but it's just a matter of how I organized and how I present them to you. That access to water and sanitation has remained an area of discussion, and it continues to be on top of the national leaders' political agenda around the world. The fact that water is life, and the fact that there are so many problems that the water sector and sanitation experience makes water inadequately available in some areas and makes sanitation poor in some places, and therefore it remains a hot area of discussion, research, and on top of agenda among the national leaders, because it's an ongoing issue. Today we have water, tomorrow we don't have water. This area has water, this other area doesn't have water. And one might wonder, with all the knowledge that we have, with all the research that we have conducted in water and sanitation, one might wonder, what is it that we still don't know? Why is this water and sanitation issue continue to be an active area of discussion and research? It's because of the challenges that, the sector is facing due to various problems that I'm going to mention to you soon. My second bullet says the water issue remains area of discussion because it is exacerbated by the fact that water is at the heart and soul of the economy and society. And literature informs you that civilization and development happens when there's water. When there's no water, civilization will be a challenge to realize. And when there is no water, also development will be realized, but in a difficult way. They say when you want to develop a place, make sure there is water. Human beings follow water. When there is water, then you can see economic development. You can see development of the area, because water is life and no one wants to live where there is no water. So the variations with regards to water availability due to different problems actually makes water remain an area of active discussion and research. And then water is also seen as a central plug to sustainable natural resources management. And we all know without water, natural resources management cannot be sustainable. But again, water is embedded in all aspects of development. There's no way we can be food secure in the absence of water. There's no way we can become or continue to be a healthy population in the absence of water. There's no way somehow we can reduce poverty in the absence of water, because we agree, I'm sure, that water is at the heart of the economic development, and therefore it contributes to poverty reduction. And when you when you look at the reports that I mentioned earlier on, the demographic and health surveys of different countries, you can actually do an analysis. You see, the DHS reports are freely available on internet. You can Google DHS report for Tanzania, DHS report for whatever country you want to get the report for. So you can go through the report, but you see the report has its objective. And depending on the objective, some of the questions that we have as researchers might not have been answered in that report. But the good thing is the Measure DHS website. Measure is measuring something. Measure DHS report, it's one word. Measure DHS website allow us to request for data, raw data, and do analysis of whatever questions, research questions that we might have. Now, my point basically here is you can ascertain some of the facts that are in the present slide, especially on poverty reduction and water availability. Get your data, do analysis on availability of water within a certain area or region or count, depending on how you name the administrative areas in your countries. Look at where there is plenty of water, and then look at the poverty variables or wealth variables. You'll find a very clear link that shows you wherever there is water, poverty has been reduced, as opposed to places where there's no water. And again, water is essential to sustain natural resource ecosystem, as I said earlier on which everything else depends on. It's important for us as practitioners within the region, as scholars, as researchers, to try and do all we can in our areas of specialization to ensure that we sustain a health ecosystem for our benefit. Poor health ecosystem means poor water resources, inadequate availability of water, and subsequent poor sanitation, and the challenges that absence of water, adequate water, and good sanitation bring about. Next, please. So I wanted us to engage in discussion, but since it's online, I don't know on what I wanted to hear your views on water and sanitation following the global recognition of the importance of adequate water availability and sanitation. But please, let's go to the next slide. So I said to myself, how can we appreciate the importance of good governance on water and sanitation? Maybe if we look at statistics on costs involved due to poor sanitation and inadequate availability of water, we might actually come to appreciate why we need good governance in place on water and sanitation to avoid all the costs that are involved because of inadequate availability of water and poor sanitation. Next, please. So the first is the challenge on public health. Literature informs, and I mentioned this before, that the lowest access to sanitation is found in rural areas. And literature informs that 7 out of 10 people are without improved sanitation. 7 out of 10 people without improved sanitation live and are found in rural areas. Now, I want us to ask ourselves, as researchers, why is this the case? And as a demographer, to the best of my knowledge, the majority of people in most African countries and other developing countries, apart from Africa, live in rural areas. So why is it that in these areas is where exists lowest access to sanitation? Is it that we don't care about them? What is it really? And this has not just started yesterday. This has been there for such a long time. But again, you look at the contribution of rural areas to the lives of those who live in urban areas. We don't have, fields to grow crops in urban areas. It comes from rural areas. And there is where, when it comes to issues of water and sanitation, the coverage continues to be poor. And this also, you can ascertain from the Demographic and Health Survey report. These reports are actually conducted every 5 years. Every 5 years. So if your country conducted Demographic and Health Survey report, let's say in 2004, then the next one will have been conducted in 2009, and then the other one I think will be maybe 2013, and so on and so forth. So what you can do is to do a trend analysis of the availability of these services in a span of 5 years, from the DHS way back to the next, to up to the current. You will ascertain what I'm saying, that lowest sanitation, access, and also water in most of the African countries actually is not a new thing. There could be some improvements, but still the coverage is not, I would say, adequate. Of course, one might ask me, what do I mean by adequate, and how do I determine adequate? And probably even, who am I to say it's adequate? But look at the statistics from the DHS reports, and you will see what I'm saying. And I'm putting this as a challenge because you see, when we go to universities to get our degrees, to get our professions, we expect you to make a difference. Of course, I'm not expecting after your PhDs, then you will just go and change things at the blink of an eye. No, but try and understand the situation and see how best you can make, no matter how small the difference, but go make a difference. And this is one area. So then I ask myself, and I ask you, is it the question of governance, poor governance, or what is it? How come in rural areas, water and sanitation coverage remains significantly lower than in urban areas? Is it because of poor governance in these areas? Or what is it? It's a question that I encourage all of us to think about and see what can be done. But it's a challenge. It's a challenge. Literature informs us that the worst situation is found in sub-Saharan Africa, where sanitation service coverage is as low as 30%. And the increase has been lower than the global average of 7%. You can see how big the problem is. Now, we're saying in water, water and sanitation governance, one of the key variables in that, the key variable in that equation, the equation of good water and sanitation governance, is stakeholder involvement. So we need to ask ourselves, do we meaningfully involve stakeholders? One. Second, have we given them equal rights to articulate what they want? And third, have we availed the rural folks with the opportunity to air their views with regards to availability of water and sanitation services? And fourthly, what does the political aspect of water and sanitation governance play in all this? It's a question that I thought of posing to you, and I'm sure we're all on the same page with regards to how statistics can inform us on the importance of good water and sanitation governance. Next, please. My statistic in this particular slide is old, a decade plus old. Yeah, a decade plus old. But still, it's data. And the challenge that I pose to you is when I share with you all the statistics, you go and look for the current one and compare the situation. So my slide says about a decade ago, it was estimated that waterborne diseases cost healthcare system as much as $539 million each year. That statistic came from an international conference on emerging infectious diseases. Imagine waterborne diseases. Millions of dollars. In our currency, I don't know how much that will be, maybe billions, spent on diseases that could have otherwise been prevented. But why is that? Is it poor governance? Or what is it? And I urge you to go through the report and see the differentials with regards to maybe areas where exactly have the waterborne diseases been happening mostly, leading to expenditure of that tune of US dollars. Next, please. Another report, again, almost a decade ago, by the World Bank, Program of Water and Sanitation, indicated that inadequate sanitation costs 18 African countries about 5.5 USD billion each year. Again, there are so many things that we need this money for. In most African countries, hospital coverage, especially in rural areas, is not that adequate. In some places, people have to go walk a long distance to go and reach out to a hospital. In some places, even schools are a long way to go. So this money could have otherwise been spent to, expand the coverage of health facilities, schools, but else is spent to help people get cured from diseases that, in principle shouldn't be diseases to spend money on. Again, what is the matter? We as practitioners in water sector, and in the context of our seminar today, in the module for that matter, is it the matter of poor governance, or what is the problem? And for how long are we going to accept this? It's a challenge, and I think we should look into it. Next, please. Oh, those countries are mentioned there. My own countries was part of the study country. We have Benin, Burkina Faso, Chad, Central Africa Republic, Democratic Republic of Congo, Ghana, Kenya, Republic of Congo, Liberia, Madagascar, Mauritania, Mozambique, Niger, Nigeria, Rwanda, Tanzania itself, Uganda, and also Zambia. Those are the 18 countries that made the study countries, which brought up the expenses on water and sanitation challenges that I mentioned in the previous slide. Next, please. Again, a desk study found that the economic impacts of poor sanitation in Africa found the majority of these costs to production come from annual premature death, including children under the age of 5 due to diarrheal diseases. In demography, again, as a social scientist, you will have to bear with me referring to demographic issues from time to time. But again, we deal with the demographics in our daily lives, regardless of our area of expertise in our professions. But I'm sure you all know what we call the under 5 mortality. The under 5 mortality is the mortality of children who have not reached the age of 5 years. Now, the desk study that I have mentioned the slide, found that the cost of production comes from annual premature death, including children under the age of 5 due to diarrheal disease. But when we say premature death, and then including children under the age of 5, what it means is there are other deaths apart from those of the children under 5, but they are premature. One might ask themselves, what does premature death mean? To some people, deaths occur because it was, meant to happen. When somebody dies, there are people who believe his or her time to go has come. But there are deaths which could have been avoided, and those are the ones we call premature deaths. And the premature deaths come from what we call in demography life expectancy. Each country has estimated life expectancy at birth. For instance, if you're born in Tanzania in 2023, you are expected at birth, other variables being constant, you are expected to live X years. So if you don't live X years, you die before you reach X years, then we say that was a premature death, because we expected you to live up to a certain number of years. Now, for whatever reason, you died earlier than the expected number of years, then we term it premature death. Every country, you can Google your countries, and I think some of you already know what is the life expectancy in your countries. So if somebody dies before, if you go beyond X years, then that's good. But if you die before the estimated life expectancy, then we call it premature death. Now, it's something which is not very highly acceptable for countries to encounter premature deaths. And when we talk of premature deaths, basically it will be death of the young people. We need human resources for economic development in Africa. Now, for us to put our house in order and experience a lot of premature death, that is a challenge to the continent, that is a challenge to our individual countries. And literature goes on to inform us that nearly 90% of these deaths, the premature death and the under five death are directly, not even indirectly, directly attributable to poor water, sanitation, and hygiene. Again, diseases which could have been prevented and lives be saved. So what is the matter? Again, in the context of our seminar and our module, is it attributable to some extent to poor governance? What is it that can be done to change the status quo? These preventable diseases, now that is my own argument, that the preventable diseases attributes to, preventable death attribute to low life expectancy at birth in most African countries. Oh, next, please. Ronell. The next, please. The adverse impact of inadequate sanitation that are likely to be significant. This is literature, but difficult and expensive to estimate. Include the cause of epidemic outbreaks, losses in trade and tourism revenue, impact of unsafe excreta disposal on water resources, and the long-term effects of poor sanitation on early childhood development. These are some of the impacts of inadequate sanitation. But literature admits it's difficult and expensive to estimate. But I would like to draw your attention particularly on early childhood development. So what it means is when we don't have good sanitation in place, then the children will experience poor development. This is very dangerous. We want to have countries, nations with children with good brains, children who will be able to study and study well and be innovative where possible, but generally contribute to the economic growth of the country. Now, when these kids are challenged in terms of their development, and development here, I believe they don't necessarily mean just physical growth, but also brain development. It's a big challenge. So, dear participants, why am I bringing all this to your attention? Is for us to acknowledge why it is important to have good water and sanitation governance in place to avoid, what we are seeing now. Of course, I fully understand. Governance in itself is not a cure or is not the only variable that can change the situation. But we have seen within good governance, there are so many, there are various, maybe not so many, but various actors and stakeholders involved. So good governance will bring these people together for them to chat out ways and see how to address these challenges. Next, please. So, despite facts which signify the critical importance of water, to date, inadequate access to drinking water and sanitation remains a significant threat to public health, as has been explained. and inadequate water and sanitation make it a major obstacle to sustainable social and economic development. Why? This could be one of the group work. We'll see when I share with you questions for group work. Next, please. Well, again, just from the definitions of water or good or governance in general, we are all aware that by now, providing people with access to water and sanitation demands a combination of solutions in the face of a wide range of problems and involvement of various stakeholders and stakeholders and stakeholders and various stakeholders and institutions and actors. And these problems, if we were to be on a face-to-face session, I would have wished for you guys to mention some of what you would consider as wide problems, range of problems that require a combination of solution in the face of, or in light, or in the cause of addressing water and sanitation challenges. But since we are online, I would go ahead and mention them. Next, please. There is obsolete infrastructure. You know, some, of course, within SADC and within Africa in general, the level of economy of the country differ. We are not homogeneous with regards to the level of the economy. Some countries are challenged with regards to infrastructure for both water and sanitation systems. I'll give you an example of my study when I was pursuing my master's in demography. I did the study titled The Impact of population increase on water and sanitation, and I picked one district in my country. And one of the challenges that particular area was facing was the obsolete infrastructure or poor infrastructure. And you know, when infrastructure, especially water and sanitation infrastructure, when it's put in place, in most cases, it considers the number of people that is expected to serve. Now, Africa, again, there are variations, but Africa remains one of the rapidly increasing population continent in the world. Now, you can imagine if an infrastructure or a system for water and sanitation had been put in place maybe in 1980, let's say, and today it's 2023. Depending on the level of the economy of the country, this system might not have been expanded since its establishment. What do you expect? What do you expect? While the system remains the same, and for instance, in 1980, when it was established or it was put in place, it was expected to save X number of people. But population keeps increasing year by year by year. So you find most of the systems are overwhelmed, and some of them, they reach a point where they become obsolete. So that is one of the problems that water and sanitation systems face. Now, everything that I present here, I wish for you to translate it into governance. What would have governance done to address the obsolete infrastructure challenge? Next, please. Ronel. Yeah, population growth. This goes hand in hand with, inadequate or overwhelmed infrastructure. I know of no country within Africa that has conducted census. For instance, let's say my own country conducted census in 2012, and last year we had yet another successful census. Censuses are conducted every 10 years. Now, I don't know of a country which conducted census 10 years ago and 10 years later realized population decline. I believe we are all on an increasing trend. We are going up. Of course, we need human capital. We are not like some countries where their situation actually draws our people to go work and live there. So for Africa, I believe we still need people. We still need people. Of course, the human capital that we have has to be skilled for us to benefit from the increasing number of people. So there are other variables which have to be, there are other conditions which have to be met for countries to really reap the benefit of its increasing population increase. But in the context of our today's seminar, I would say population growth is one of the challenges to access to water and sanitation, because maybe even countries whose economy within Africa, and SADC in particular, maybe the rate at which they can expand this infrastructure or put up new ones to accommodate an increasing population doesn't happen very frequently. But again, I'm very much cognizant of the variations. Some countries are better off than others. Yeah, like that. And again, within a country, as I said, there are differentials, rural, urban, and the like. But population growth is one of the challenges to accessing water and sanitation. Climate change and variation is another example. While the first two, obsolete infrastructure and population growth, we somehow can manage and can have control of, I would say. But when it comes to climate change and variation, I don't know how we can control that. Rains come in months that we don't expect. They last probably longer than what we would expect or we had been experiencing before. And it impacts us. It has an impact on our water resources and water resources management, and of course availability of water and proper sanitation. Droughts, floods, that come because of climate change are things that yet present formidable challenges to accessing water and proper sanitation. But again, what can governance in water and sanitation do? Next, please. Next, please. Pollution. Now, this, to some extent, we have control of. To some extent. In other places, we have industries which are put in place without abiding to rules and regulations of safe disposal of water and other waste products from whatever they are doing. Industries, and of course, it affects us all, and it poses a challenge to water resources management and water and sanitation systems in place. Next, please. And of course, lack of specific sectoral policies in some places. See, a policy actually provides a roadmap, how we should go, where we should go, who is to be involved. And these policies normally have two forms, implicit and explicit policy. So sometimes in some situations and contexts, we lack specific sectoral policies to guide us on water and sanitation matters or issues. Next, please. Corruption. Literature informs us corruption is one of the problems that affects the water and sanitation area. Next, please. Inappropriate institutional arrangements. At times, more than one ministries deal with one issue, and it becomes a problem. We keep stepping on each other's toe, and finally nothing gets done properly. So that is also one of the challenges with regards to access to water and good sanitation. Next, please. Well, literature informs of insufficient human capacity. Now, how can I explain this? At times, again, there are variations from one country to another, from one place to another. Sometimes people tend to like to pursue career in a certain aspect or line. And you might find another line has few people. So you find insufficient human capacity with regards to different aspects or lines of specialization. Next, please. Yeah, pollution literature informs us that it's a direct consequence of uncontrolled and fast development, including the establishment of industries, and of course of population and human activities related to it. Because whenever you realize an increase in population, definitely human activities will also increase. And that has the potential to pollute your water and water resources. Now, this next bulletin, which talks about beds in hospital of the world occupied by patients with waterborne disease, it's again, it was supposed to go to the public health challenge. And the following one also from UNICEF, which tells us that 1.8 billion people drink fecally contaminated water and 2.5 billion have no access to basic sanitation. And as it reads, the last bulletin, that those are threats to public health, but also they hamper economic development in the process. Next, please. Now, as I said, you will recall earlier on, I mentioned that while water actually receives, I would call, adequate attention, sanitation, to me, doesn't receive adequate attention. And the World Bank report, again, of a decade ago, informs us that in most countries, current investments in sanitation are less than 0.1% of the GDP. Only 5 of the 18 African countries surveyed invest 0.5, 0.1% and 0.5% of the GDP in sanitation. Now, these are the countries that I mentioned to you earlier on, which spend about 500 million on costs for waterborne diseases. This report continues to inform us, the World Bank report, that although African countries were committed to increase their budgetary allocations to sanitation to at least 0.5% of GDP, and this is from the Etiquette Declaration, you can Google it, but none of the 18 countries surveyed had reached that target. That was in 2010. So sanitation is you can see and concur with what I said earlier on, my observation that sanitation requires us to, I don't know whether to use the word advocate, for more investment to it, because it is important to save lives. Next, please. This goes without saying that water and sanitation and also hygiene services are critical for economic and social advancement in our continent. And investment in the WASH are direct investments in public health and well-being, contributing to a happier and healthier population, as well as increasing productivity, job creation, and economic development. So again, in the context of governance, how does this sit with good governance in water and sanitation? But these are the benefits if we can realize that. Next, please. The Africa Water Vision calls for equitable and sustainable use of water for development. In 2015, African heads of states and sectoral ministers adopted the, now is this Ngora Ministerial Declaration on Sanitation and Hygiene? Of course, as I said earlier on, calling for sanitation and hygiene budget lines to reach a minimum of 0.5% of GDP by 2020. Despite the commitments, minimum increase has not been reached, and access to WASH is still limited for millions of people across the continent. Again, it's about the budgetary issues and challenges that the continent is facing with regards to WASH. Next, please. Next, please. These are commitments. You see, what we must appreciate is that heads of our states are aware of the challenges and they make commitments. Now, whether the commitments are met or not, that's a different question altogether. But I urge us all to acknowledge, at least acknowledge the recognition of the importance of WASH services by the heads of our state. So they recognize that WASH services are critical to realizing the aspiration articulated in Agenda 2063, that is the Africa we want. The leaders of African countries have made commitments to invest. And those 4 are the commitments made, 2 of them in 2008 and 2 again in 2015. So commitments are there, which is a good thing, you understand. When people appreciate the challenge and go to a point of making commitment, I think it's a good start. Challenge is to meet the commitment, but once you have a commitment in place, I would think it's easier for you to go back and see why didn't we meet the commitment, as opposed to if there was no commitment at all. Next, please. Ronel. Next, please. Now, over one third of the population lacks the safety and the convenience of basic water services, and nearly 2/3 do not have safe sanitation services. Again, these are statistics for us to appreciate the importance of good governance and see how good governance can actually change the statistics. Women and girls often bear an equal burden of hardship from inadequate WASH services. This is, I believe, a fact that we are all aware, and literature, of course, informs us of that. Next, please. So in WASH service delivery, the constraint is on financial gap at all levels. Of course, the maybe 2 slides before this one was focused on Africa, but literature informs us that the financial gap and constraint include even those of the international aid commitments. And this declined from 3.3 billion to 1.7 billion in 2017 in sub-Saharan Africa. So it's not just Africa which fails to meet its commitment, financial commitments, but also the international aid. But this doesn't make, 2 wrongs don't make a right. But it's just that we should not think that it's only in Africa where we are failing, but internationally there had been, observed a financial constraint in the WASH service delivery. And the total current investments must be tripled, literature informs, to an annual amount of $114 billion, requiring 6 times the current rate of national government spending to WASH sector. Now, this is a challenge because it's a lot of money that is required to improve the situation. But much as it might be difficult to invest the amount that has been mentioned here, but I believe to some extent something will be done, because We need good wash services in place. Next, please. All African countries adopted the 2030 Agenda for Sustainable Development, calling for universal and equitable access to safe water, sanitation, and hygiene by 2030. So we are on the same page and we adopted the agenda. But the current rates of progress, literature informs, it will be another 150 years before the continent reaches its goal. That's a way, way, way long to go. But, being on track is pleasing. The governments need to act now to accelerate the improvement and expansion of wash services, which are essential to nearly all aspects of economic and social development. Next, please. Now I wanted to share with you the coverage, percentage of wash coverage in African regions. Yeah, we have 1, 2, 3, 4, 5. We have the North Africa, West, Central, East, and South. And I'm sure you can all see very clearly how the North Africa stands, where the North Africa stands as opposed to other regions. In the water, that's water services. I think in this map, not I think, but I see, and we all can see, Central Africa is the worst case. Of course, East is also not a very good case in point, but North, West, and South are better off. And this speaks to my point earlier on that there are variations within the region. Next, please. And this is a map on sanitation services. Again, North Africa leads, followed by Southern Africa. The rest are struggling. The rest of the regions are struggling. Next, please. Next, please. Hygiene. Hygiene services, wow. Central is bad news. Again, Northern Africa leads. Next, please. This is a practice that I don't know what to say, but no toilet or latrine facilities. Again, Northern Africa leads, whereby it's only 2% with no toilet or latrine facilities. But I don't know, should we say the situation is not that bad? 18, 17? But maybe we should aim at having single digit. And a single digit that is not close to 2 digits. Maybe there we can say we are much better from my point of view. Next, please. Now, sorry, can you go back to the water map? Sorry, Ronel. Can you go back to the water map? Ronel, are you there? No. Back to the water map. That's hygiene. Let's go to the water map. Yes, thank you. Now you see the coverage of water in Northern Africa. We can say attributes to their low mortality as opposed to other regions. So what Ronel took us to, what we call population pyramids. Can we now go to that pyramid, please? Yes. I took an example of Egypt from countries of Northern Africa. Now, I want you to focus on the lowest bar, which indicates 0 to 4. I'm sure we are all on the same page. 0 to 4 means children who are under 5. They are 0 year to 4 years old. And then look the next bar from the lowest, and that is the 5 to 9. Now, what this population pyramid, by the way, is the distribution of the percentage of male and female population of a country. You can Google population pyramid of your own country and see how it looks like. In most cases, probably without any exception, you find out that the population pyramid of African country is an inverted, looks like an inverted V with the broad base. The base is broad, which means children who are born are big in numbers. That is what I said earlier on. We are on the increasing trend of our population. Now let's go back to the point of availability of water, good sanitation, and good hygiene with regards to Egypt as opposed to other pyramids of other countries that I'm going to share with you. Now the 5 to 9 bar shows survivors of 0 to 4. I hope it makes sense. A child born today, before the child reaches first birthday, that child is considered 0 year. And when they reach 1 year, they are still in the 0 to 4 because they are 1 year, then 2 years, then 3 years, then 4 years. So these children who were 4 years, who were in this group, 0 to 4, 5 years ago, 5 years later, they are the survivors of that particular group. So they reach 5 to 9 years. I hope it makes sense. So with regards to child mortality, the under 5 mortality, you can see not almost, but I would say all children born in Egypt, of course, as other children in the world, demographically, when we categorize them as 0 to 4, they survive to the next age group. No child dies. Of course, there are other variables, but water and sanitation speaks to the good statistic that we are seeing for Egypt, which is located in the Northern Africa that I shared with you. I hope it makes sense. Can we go to the next, please? And I'm aware we're supposed to finish at 1. We have a few minutes left, but I'm sure I will be able to finish. Next, please. Next, please. Yeah, this one again is for Egypt. You can see their mortality rate is very low because almost all the bars survive to the next. And you can see for instance, maybe it will be between 5 and 10, they are protruding bars. Now one may wonder if the preceding age group is the survivor, or sorry, if the succeeding age group is the survivor of the preceding, how come there is a protrusion? So that shows us that at that particular time, maybe 10 years ago, they used to give birth to many children, and now their fertility rate is going down. But all the same, what I aim to showing you here is how the 0 to 5 survive, as opposed to other pyramids that we're going to see. Can we go to the next, please? Now, see, this one is for Uganda. Look at the lowest bar. It starts tapering off as you go up, which means mortality is very high. I hope it makes sense to you all. I hope it makes sense. And Uganda is in East Africa, and we saw the statistics for water, sanitation and hygiene, and toilets for Eastern Africa. I hope it makes sense. You can see how different this pyramid of Uganda is from that of Egypt. Next, please. Nigeria is similar story. It's Western Africa. It's again different from Northern Africa. The broad base, it's tapering off. It means it is going like this, as I'm showing you on the screen. It's making an invented V because people are dying as much as compared to, I mean, many more people are dying in these countries that I'm sharing with, as opposed to Egypt. Next, please. This is my own country. I present from Tanzania. You can also see it's similar story. We are located in Eastern Africa, and the statistics that I shared with you are not as good as the ones in Egypt. Next, please. I told you about the life expectancy. Now look at Egypt. A child born in 2020 was expected to live almost 71 years. Look at the other countries. Look at Tanzania, 66, Nigeria, 50, almost 53, and Uganda, 62. And I'm sharing these statistics with you in the context of the statistics I shared with you with regards to mortality due to poor water and sanitation, and the maps that I shared with you. Look at what is happening in Northern Africa, and look at their pyramid, and look at their life expectancy at birth. Next, please. The intervention rates is said to be low, but also political neglect is also said to be a challenge, and also lack of funding in terms of water and sanitation. Next, please. So governments and non-government organizations are increasingly viewing good governance of water and sanitation as a condition sine qua non for establishing lasting access to water and sanitation for their people. That is what literature tells us. And how societies choose to govern their water resources has a profound impact on the people's access to water and sanitation, as well as on the people's livelihoods and sustainable water resources management. And good water governance and sanitation are among the pillars of any strategic approach to solving water and sanitation problems. Next, please. So the IWRM approach has been introduced to improving the governance of water. Next, please. And as I said earlier on, it's actually a new paradigm shift, which moves from the traditional system that guided day-to-day water and related interactions in local communities to involving various stakeholders. Therefore, it has changed the way water and sanitation is governed. Next, please. And next, I know you know the definitions. Next. The principles of the IWRM, all those I'm sure you know. The equity issues. Is that not the last one? Next, please. Is that the last one? It keeps coming back. Did I? Well, the IWRM again speaks to governance as a definition because it involves the stakeholders and the three E's that we talked about: efficiency, equity, and environmental sustainability, which are also the components of good governance. Next, please. These are the ones that we mentioned differently, but more or less the same. Next, please. These are the same things we talked about: efficiency, equitable, and transparency. Next, please. Environmental sustainability, we also talked about it. Next, please. Interaction and coordination within and across sectors, we talked about it. Next, please. Economic well-being of people, stakeholder participation, and as I said earlier on, IWRM is a paradigm shift from the traditional approach to managing water resources, from the traditional top-down to supply-led that were dominated by technology back then. Next, please. I should be finishing. These are all talking about IWRM. Next, please. And the benefits are there. We all know the benefits, but you can read since time is up. I don't want everybody to leave and I'm left alone. Next, please. The gender issues, we talked about them, disparities. Next, please. And that's it. Thank you for staying on. It's been somewhat long, 2 hours almost and a quarter. And my apologies for the challenges we encountered earlier. And thanks for your perseverance. And I'll meet you tomorrow, God willing. Oh, Renee, you were also a participant in my class.
As soon as I finished my meeting, I quickly hopped back into the class. I wouldn't miss it. I wouldn't miss a moment to just draw from your expertise. And thank you so much. I think I speak on behalf of the whole group, including the secretariat that was sitting through. I can see Dr. Mabuku there. Yes, it was a very insightful presentation. Thank you so much. Colleagues, are there any questions maybe that you might have for Professor Dungumaro? Areas for further clarification? I'm actually going to hand over to Dr. Mabuku as she's the facilitator for the session. I was just hopping in to say thank you to Professor Dungumaro. So Dr. Mabuku, over to you to continue.
Okay. I see a hand from Jimmy Katambo. Please, Jimmy, come through.
Good afternoon, Prof. Thank you for the presentation.
Prof, you are muted.
Sorry. Okay.
Right.
Afternoon, Jimmy.
Yes, thank you, Prof, for the presentation. I have a question on one of the slides where you are showing the statistics for Egypt. Yeah, so I just want you to explain a little bit more. I didn't understand it, where it is showing the trend between 5 and 10. It is much more than the one between 0 and 5. That graph for Egypt 2023, which is showing the population trend. So the one that you explained, I didn't understand. You said there is a reason why the lines, the bar lines are more between 5 and 10 compared to between 0 and 5. Yeah, so I want to understand it better. I missed the explanation.
Okay, Dr. Magu, can I respond to Jimmy?
Yes, please go ahead.
Yeah, it's actually a very good question, and in most cases, when I share these slides with the participants of different groups, this comes up, and it gives me a pleasure that we were together, all of us. So you see, there's a decrease in fertility, the number of children that are born. So
Yes.
10 years ago, people were giving birth to many children. So that bar was broader 10 years back. And again, as I said earlier, because in Egypt, mortality rate is very low, especially child mortality, then they survived. So their protrusion to the left and right is because they were born many in the first place. And if I had time, I could have shown with you some of the pyramids of other countries whose fertility rate some years ago was high as compared to in the recent past. Does that make sense, Jimmy?
Yeah, so you are saying they are born many 10 years ago, but then when they reported the ones for the 0 to 5, they reported less than the ones that were reported for 5 to 10.
Yes, because the 0 to 4 now, the children born are much less. And so this 0 to 5, 0 to 4 will again be the survivor to the group of 5 to 9. It's the same group actually that goes up. But again, those who were born before 5 to 9 were many. That's why the graph, the bar is broader.
Okay.
Actually, please go on.
Meaning they are not okay. The ones that were, I mean, the extra number, the additional number, it was not reported between 0 to 5. So it is covered between 0 and 10.
No, it is. You see, the 0 to 4, who then will go to 5 to 9. In the years when the 0 to 4 or 5 to 9 goes up and take over the 10, I think to, is it 14? They will still be the same bars. They want to protrude. And those ones, the 10 to 14, they'll go to 15, 19. So they keep going up. And the ones that were 0 to 4 will take over, and the newborn will also take over. And if the newborn, for instance, are also going to be much less with regards to their number, I mean the number of children born will be much less, then you'll also find the same trend. That is the 0 to 5, the 5 to 9 will be broader than the 0 to 4, just in case their fertility goes down.
Okay.
I think we have a similar situation also in Kenya. If you look at the population pyramids of Kenya some years ago, you might wonder how come now the younger children are much less and the broader the groups ahead of them. Then you wonder where these survivors coming from? But actually, it's because their fertility rate, when these broader groups were 0 to 4, there were many as compared to the ones that are being born now. These are have to do with the family planning issues, but also the generally factors which are associated with fertility decline.
Okay, thank you, Prof.
You're welcome, Jimmy.
Any other question from anyone? Any comments? Okay, I don't see. Okay, Petrus.
It is Petrus.
I have one, but I'm put in chat.
Go ahead, Petrus.
Okay, thank you very much, Prof. Dungumaro. It
You're
was
welcome.
really a presentation that for me it really resonated very well, especially when it comes to governance in relating it to sanitation. Talking from Namibia, and of recent, we had issues of people have to be attacked by crocodiles because they have to go to the river to access water, for sanitation, and so forth. So when you explain the issue of the need for us to address in terms of governance relating to rural area supply to rural areas, I really felt that was quite very relevant, because issues are still going on. If we could bring sanitation close to the people, some of the problems our people are facing, I believe, could have been mitigated. So really that issue really went very well with me. So I really appreciate the presentation. Thank you, Prof.
Thank you, Petrus, for that comment. I appreciate as well.
Any other?
Good morning, I'm Emanuela. I have one exploration, but I put my question on chat.
I see it, yes, but go ahead.
Yes, I want you can improve a little bit more how sensor can the more distribution better for the resource for how sensor, because most country not make a sense for the population. So how the sensor our population can help in these directions, the food sanitation.
Thank you. Dr. Mabu, can I go on?
Yes, please. Yes, please. Go ahead.
Yeah, I beg to read Emanuela's question, and thanks for the question. On the comment, she said, Prof, according to your experience, how can census contribute to better distribution of internal resources? Actually, one of the reasons we conduct census is not just to know our numbers, but to use the numbers for planning purposes, and again, for distribution of internal resources. But you are right, there are countries which do not conduct the census. Census actually are very expensive exercises for the countries. And some of the countries fail to conduct census because of the massive money that is involved. But other countries which do not conduct census, but they still have up-to-date statistics of their population, they use what we call population registers. And these are countries which have in place good, what we call vital statistics registration. For instance, I live here in Iringa, and in a certain suburb which is called Mkwawa. If I move to another suburb, my particulars are transferred there. So in Mkwawa, they will have minus me, and over the other place, they will have plus me. So all the statistics are well kept, and they are used for distribution of internal resources and planning purposes, what systems should go where, and what money should be involved. So census, where they are conducted, one of the purposes is to help for planning. You know, I always tell my groups that I present issues of census, you know, knowing about the number helps you to plan for resources, as Emanuela said. It goes back even to a household level. How will I know how many kilograms of rice will I cook if I don't know how many people are expected to have dinner in my house? So the same applies to the national population size. It informs us of planning for water, schools, housing, hospitals, and all such kind of things. I hope, Emanuela, you got me. If you're not, then just ask me.
Yes, I agree. I agree, because we sometimes spend a lot of money for the census, but after this, we not use this data for make up a good plan for our city or our community in these directions.
Yeah, that then the purpose is defeated. We had the census last year, probably some of you are aware, and for Tanzania, what we did this time is to have a guideline on how to use census for different sectoral ministries. So sometimes you need that for people to be able to know and actually make use of it. Otherwise, then it is a lost resource. Knowing just the number is not enough. That has to be used and used properly to inform resource allocation.
Thanks so much, Prof.
You're welcome, Emanuela.
Thank you so much, Prof, for that. I think Emanuela understood the response. Any other question, guys? Any other comment before we close and release Prof? Okay, I don't see anyone's hand. Prof, thank you very much for coming today. Though we lost the first hour because of technology, but I think tomorrow we managed to cover what we needed to cover today, isn't?
Yes.
So we didn't lose anything.
No.
Okay, so we just tried to rush so that we finished. That's okay. So we'll start tomorrow again at 9 o'clock.
Mm-hmm.
The same, we are going to use the same link.
Yes, and once again, my apologies to the Secretariat and to all participants for the technical hiccup, but I'm going to get my IT people. You see, the thing is they don't have marks, so they're hiding in that excuse. Prof, but we don't have marks, so, here and there. But, when you are an IT, I expect you to be a problem solver, whether I use HPE, Mac, or whatever. But anyway, probably I have to understand their challenge, but I'm going to task some of them to make sure they assist me so that tomorrow we start on time.
Okay, so you can as well just send your PowerPoint through for tomorrow. So in case we are not able to sort out your issue the other side, then we can just do what we did today.
Okay, I'll try to do that ahead of time.
Okay.
Yes.
All right. So for today, the PowerPoint presentation is in chat. I hope everyone has seen that in the chat. I think I shared it there. So please download it from there. Mm-hmm. Yeah, okay. No, thank you so much. We'll see you tomorrow again, 9 o'clock, same link.
Thank you. It was a pleasure. See you tomorrow. Bye, everyone.
Bye.
Goodbye.
Bye-bye.